The following is a production of Different Brains. Visit us at differentbrains.org.
The following Different Brains content was funded in part by the Community Foundation of Broward and support from people like you. In this episode of Exploring Different Brains,
one of the first things that anyone who works with people with IDD or provides healthcare or talks with people with IDD should do is really presume competence. Presume that the person you're speaking with, that you can have a conversation with them, that they can provide information to you, and speak to the person themselves. So many times, there might be someone who accompanies the person with intellectual and developmental disabilities to a healthcare visit, and we tend to speak straight to the person who's there with the person, and never really even communicate with the person directly who's there to receive the healthcare.
Welcome to Exploring Different Brains. I'm your host, Dr. Hackey Reitman, and today we have joining us Dr. Craig Escudé, who's got a lot of stuff going on to help those of us with different brains. He's the president of IntellectAbility and the host of IDD Health Matters podcast. Welcome, Craig.
Thank you for having me, Hackey. I really appreciate the opportunity to be here.
Well, I know you're busy, and I know schedules are tough. Now, tell us all about IntellectAbility.
Sure. So IntellectAbility is a company that focuses on providing tools and training to help people who support people with intellectual and developmental disabilities to be able to better identify health risks that are often missed and to know what to do to mitigate those health risks to try to improve health and wellness for people with intellectual and developmental disabilities.
Well, that's great, but I'm going to even take you back a step because as an MD who trained in Boston University, we never learned anything about IDD, and they're still not learning. So you have the practitioners who are our first line of defense, and what are you doing to change all of that?
So I'll back up before I answer that question and tell you that I share the exact same story of really not receiving training to provide good health care for people with intellectual and developmental disabilities. And while we've made some progress, that's still a problem today. Most health professional training programs, including medical schools, nursing schools, and other health professions, really do not provide any or at least not enough training to help health practitioners to better be able to provide healthcare for people with IDD. So that is something that has through my own challenges, and when I first started working in this field and my own recognition that I really didn't have the best skills to be able to provide good healthcare, I developed a program to provide training and education specifically to healthcare providers, in addition to all of the other services that we offer through our company.
And what is the name of that?
So that's a program called the Curriculum in IDD Healthcare. It is a web-based curriculum that consists of 6 different modules that, to me, teach the fundamentals of providing good healthcare for people with intellectual and developmental disabilities.
And how long a course is that?
So the runtime of the course is about 4.5 hours, and you can throw in another 20, 30 minutes because there are knowledge checks and questions after each of the modules. The course is approved for continuing medical education credits and also for continuing education units for nurses. So we keep track of the progress through the course and provide those post tests at the end to ensure that people do complete the course to be able to qualify to get the credits.
Does it give you a certification?
So it gives you, again, the continuing education credits, but we also offer through our company what we call the recognized provider in IDD Healthcare. So there's a badge and a certificate that goes along with the successful completion of that course. And that's really to help recognize that those providers are not only interested, but have had some additional training in providing good healthcare for people with IDD, and they can use that badge, for instance, on their website or in other, advertising material to indicate that they have an interest in providing good healthcare for people with IDD.
So, in teaching medical professionals about IDD healthcare, what are some of the main points that need to be emphasized?
Wow, there's so many. So I'll start with one that I think is important. And one of the first things that anyone who works with people with IDD or provides healthcare or talks with people with IDD should do is really presume competence. Presume that the person you're speaking with, that you can have a conversation with them, that they can provide information to you and speak to the person themselves. So many times, there might be someone who accompanies the person with intellectual and developmental disabilities to a healthcare visit, and we tend to speak straight to the person who's there with the person, and never really even communicate with the person directly who's there to receive the healthcare. So we really need to ensure that we're communicating with people who are the patient primarily, and other people can certainly chime in as help is needed. But we really should include the person with the intellectual disability in the conversation to the best of their ability. Another one I'm going to add, which I think is also equally important in terms of clinical and diagnosis, is there's a concept called diagnostic overshadowing that we see in when we provide healthcare for people with IDD or serious mental illnesses, and that's where we as clinicians tend to maybe take some symptoms that we see and attribute those symptoms to the overall diagnosis of the intellectual disability rather than looking for a treatable underlying cause. And so a great example of this is where a person, for instance, might start having some agitated behavior. Maybe the person can't communicate with words, so they can't tell you what's going on, but they start maybe hitting themselves in the face or hitting other people, or at meal times they become very agitated and they spit out food. So what often happens is the clinicians see this type of behavior as well, this is just something that people with IDD do sometimes, and so we need to put them on a medication to stop that behavior, without ever looking at an underlying treatable cause, such as maybe the person has a toothache and they're in pain and they can't communicate that to someone else. So the only way they can communicate it is by spitting out food because it hurts every time they try to chew, or they become upset and they hit their face or their mouth because they're in pain. So another thing that I think is really important for clinicians to recognize is that concept, and to be aware of it, and to always look for underlying treatable causes rather than attributing some symptom or behavior to the overall diagnosis.
Very well said, and it's something that any kind of clinician has to be aware of.
Absolutely.
So, the IDD Health Matters podcast, tell us all about that.
Sure. As you mentioned earlier, I'm the host of the podcast, and I kind of got roped into it. Wasn't something I was seeking to do for sure, but I was approached by a residential provider organization who provides residential services for people with IDD. They're based out of Ohio, called Friends for Life, and we had a few conversations, and they started a podcast with the mindset of helping people understand this field and helping people see that they can have a career in this field, and as a way to reach people where they're getting information. And they wanted to add me on to provide a perspective on health and wellness for people with IDD. So at first I was quite resistant, to be honest. And I started doing little bitty segments that we called Medical Mondays. and they were about 2 or 3 minutes where I would just talk about a medical topic related to healthcare for people with IDD, and did that for about a year and a half. And they asked me at that point to up my game, and they wanted me to do a real podcast. So I thought about it a good bit. And over the years of working in this field now at a national level, I've gotten to meet so many people in this field, from self-advocates to state developmental disability directors, to leaders of organizations, to CEOs of residential provider services, and really so many nurses and physicians who work in this field, including yourself, Aki. And everybody has a story to tell. And I thought about it, and I'm like, what a great way to help people understand this field, to help people understand some of the challenges that we face, but also see some of the successes that have occurred over the years, to where people can tell their story and show, again, that this is a great field to work in, and that there's a lot of need for people to be a part of this field to improve health equity for people with IDD. So I started that podcast about a year ago. We released our first episode July of 2023. And I'm happy to say that we actually have already received national recognition. We won the AAIDD, the American Association on Intellectual and Developmental Disabilities 2024 Media Award for that podcast.
Congratulations. That's great.
Thank you.
In educating healthcare providers about IDD, what have been some of the big challenges?
I think the biggest challenge, but also the easiest one to overcome, is to recognize that people communicate in many different ways. And what I mean by that is, in particular in this field, when you're working with people with intellectual and developmental disabilities, sometimes they don't have the words to be able to express what's going on. They may not be able to tell you, oh, my stomach is hurting, and oh, I feel nauseated, which is why I don't want to eat and why I'm losing weight. But they're still going to communicate those things in different ways. Usually it's through some sort of change in behavior. And when we can help clinicians to recognize the different ways that people communicate, then we're going to be able to make better diagnoses and better treatment plans, and prevent unnecessary suffering from treatable conditions.
What do you think really has to happen to get all medical professionals on board with this?
Well, I think there has to be kind of more of a pull from the top than a push from the bottom. And what I mean by that is, I think one of the bigger factors that needs to occur is that the organizations who provide accreditation to medical programs, health professional training programs, need to start putting an emphasis that on the need for health care for people with IDD to become part of training programs. When our board exams, for instance, licensure exams, should ask questions related to a person with an intellectual disability and some specific conditions related to those. So when we see, the accrediting bodies say requiring education in that field, and we know that they're going to be asked questions on board exams, then I think that's really going to help encourage or nudge health professional training programs to start teaching that information, because they know it's going to be part of their exams, and it's going to be a requirement by licensure bodies.
And one of the fellows who's been a pioneer in helping make that happen is our friend who introduced you to us, Dr. Rick Rader of the AADMD, of which you are a member. Tell us about your involvement and more about the AADMD, as well as what the initials stand for.
Sure. So AADMD stands for the American Academy of Developmental Medicine and Dentistry. And you can find out more information from them at aadmd.org. But I'll tell you a little of the basics. So an organization was started by Dr. Rader, our friend Rick, and a few other people a number of years back, because of they recognized the importance and the need and the value of educating healthcare providers about healthcare for people with IDD. Both it was a group of medical professionals and dental professionals. And this organization has continued to move the agenda forward and has helped facilitate incorporation of training into medical schools and dental schools throughout the country, as well as provided some insight and some position statements, I guess, on some very important positions or very important topics, such as whether or not people with IDD should be able to be eligible for organ transplants, so on and so forth. So it's a great advocacy organization for physicians and dentists in particular, but certainly any health professional can gain insight. And I would highly encourage clinicians to look into this organization and become a member. It was very valuable to me when I found out about it about 11 years ago, because it was the first time I realized that there are other people who work in this field and they've had similar experiences that I have, and I can learn from them. And in some instances, I've been able to help train others as well through the organization.
Now, what advice would you have for somebody who is themselves neurodivergent or the parent of a neurodivergent individual who wants to find a doctor that understands IDD? How do you find them?
Well, if they took the curriculum in IDD Healthcare, look for the badge, but we've still got a long way to go on that. I think, talking with others and asking them where do they receive their healthcare and where have they had good experiences is one way to do it. Using our colleagues, the resources that we have, people that have been in similar situations, is one way to find people. But the other thing you can do is really, take time to interview someone or build a relationship with a clinician outside of a crisis moment. So maybe make an appointment with a clinician where you can go in as an introduction and say, hey, I'm such and such, and I have, these particular conditions. Or if you're a family member, say, hey, here is my loved one, and I want to get to know them, and we want to get to know you to see if we can facilitate a really good, healthy, healthcare relationship. And that can go a long way, because what some of the, rightfully so, many times people with IDD or their supporters are really frustrated about the maybe less than optimal healthcare visits that they have. And I'm using nice words here because I've heard many stories of really appalling situations where people were, had some big problems trying to access healthcare. But when we're in a crisis situation, all of our emotions are up. So I think, finding a clinician and trying to build that relationship outside of a serious healthcare need would go a long way to helping, helping find a good match between a healthcare provider and a person with some sort of neurodivergent condition.
And so a corollary to that would be, in the interest of getting more doctors who know about this stuff, what's preventing that kind of information from being taught in all medical schools?
Well, that's another great question, Hackey. I will say that the first thing that needs to happen for someone to have a change in curriculum is they need to see that there's an actual need to teach people about it. And that is something that even I wasn't aware of. I didn't realize that there was more information I needed to know to be able to provide good healthcare for people with IDD when I got out of my medical school and residency training program. I figured I was taught what I needed to be taught. So why do I need to learn more? It wasn't until I began working in this field that I realized very quickly, wow, I need to learn a lot more about this field. And I started seeking out opportunities to find information. And back then in the 90s, when I was just getting involved in this field, there wasn't very much information out there to learn as a healthcare provider. So I didn't recognize that I had the need to learn this information. And unfortunately, I think a lot of health professional programs still don't think that there's a need to spend valuable time during a student's training to teach this information. Now, the other side of that is you've got the curricula are very packed. And there's a lot of information that have to be taught to medical schools and to medical students and nursing students and others. So there's an issue of finding time. Where do we fit this into the curriculum? How do we add more to the curriculum? The third challenge, I think, is who's going to teach this information? You've got to have clinicians who have enough experience and expertise in this field to be able to teach others about it. And unfortunately, we don't have enough of those. There aren't enough clinicians who understand this field well enough. For instance, if right now every medical school in the country and every nursing school in the country wanted to hire a faculty expert on intellectual and developmental disability healthcare, they couldn't find them because there's just not enough clinicians to go around. And that's actually one of the reasons I created that online course, because it's a way to get information into health professional programs and to practicing clinicians without having to say hire an expert to be able to do that.
How can our audience learn more about you?
Well, a few ways. I guess first, if you look up IDD Health Matters on any podcast platform that you like to listen to, you should be able to find it, and you'll see lots of episodes and can learn more somewhat about me, but also a lot more about the field. If you wanted to learn more information about our company and what we do, our company's name is IntellectAbility, and the website is replacingrisk.com. So replacingrisk, one word, .com. And on that website, you'll see all of the tools that we offer. We have the health risk screening tool, which is a web-based tool that is used to screen for health risks in people with IDD. It's currently used in about 26 different states, and it's used to screen over 100,000 people who receive supports and services who have intellectual and developmental disabilities. We also have an array of e-learning courses that are available, not just the one I mentioned, but also we have courses on the Fatal Five, which are the top preventable causes of illness and death, choking prevention, and many other courses that people can take or use in their programs to learn more about IDD healthcare. And we also do person-centered thinking training services as well. So again, just jump on replacingrisk.com and you can learn a lot more about us.
Is there anything you'd like to cover, Craig, that we haven't covered?
I think one of the primary things that we have to think about is we've got to think of people with any condition as a person first. Sometimes we think about people by their diagnosis, and we say, oh, that's a person with disabilities, and then we have preconceived notions. Well, they can't understand anything. Well, they're not going to benefit from healthcare. Well, they don't really have the same quality of life as other people. And those are, preconceived notions that we have that hinder our ability to provide good healthcare and good supports for people with IDD. So if we see the person as a person first, with the same desires, the same interests, the same likes, and the same goals that they have for their lives, and wanting to live a good life and wanting to live a healthy life, if we see them as people first, just like everybody else, then we're going to be much more likely to invest our time and energy into getting accurate diagnoses, providing treatment plans that are effective, and really improving the lives of people that we all support.
Amen. That would solve a lot of problems in this world if we could just get people to look at each other as human beings and As Martin Luther King said, judge me by the content of my character and not the color of my skin, and in this case, not by my IDD.
Right, not by my abilities or differences.
Yeah.
Couldn't agree more.
But for you to pick one thing, Craig, that you wish every medical provider understood about patients with intellectual issues, what would that be?
Well, I touched on a couple already, so I'll leave those. One is to see people as people first. The other is the concept of diagnostic overshadowing. So I think those two are important. But to add to that, I would say that there are many people who do not use words to communicate that suffer needlessly from treatable or preventable conditions. And as clinicians, it's our job to know how to recognize signs of those conditions and to know how to treat those conditions appropriately and to, again, provide good health care to all of our patients, to everyone. And it does take a little bit of a different lens. It takes a little bit of training. There's a little bit a different approach that can enhance our abilities as clinicians to be able to recognize these early signs of preventable or treatable causes that are so often missed. So the one thing I would say is seek out additional training, whether it's online training, whether you can work through your health professional programs, through your medical schools or nursing schools to implement some sort of training. Seek additional training and work to help all people to be able to receive the same level of health care, whether they have a disability or not.
Well, very well said, Craig. And on that note, I want to thank you for giving us so much information and for doing all the great work that you do for those of us whose brains are a little bit different and have various disabilities. And want to encourage you to keep up the great work that you do for so many. And please keep in touch with us here at Different Brains.
Thank you so much, Haki. It's an honor to know you, an honor to be on your program, and thank you for the incredible work that you do as well.
Exploring Different Brains is a production of Different Brains. Visit us at differentbrains.org.